Mm-hmm. How does that make you feel? Yeah, well, it's not like it's an irrational fear, okay? It makes a lot of sense. But anyway, so we are here today to take some blood from you. Now, ordinarily, this would be a very speedy process, usually conducted by a nurse, completely safe, secure. But I know that it can be a worry for you. A fear of needles combined with the idea of someone taking your blood is scary, and I think everyone gets a little bit scared of it. So, instead of it being a fast process, we're going to spend a bit of time acclimating you to the idea of a needle and taking your blood. Okay? We're going to start off. I'm going to ask you just a few questions just to gauge how severe your fear is before we move on to a few exercises that are simply designed to help you relax. And then we'll finish off by taking a look at the needle that we'll be using, doing a few little test runs, and then we'll take the blood. Okay? What I need to emphasize is that you are in complete control of this situation. If you want to stop at any point, just say so. Okay? I won't be upset. We can just reschedule, do it again, or not do it. There are other ways. Okay? But for now, I want you to answer just a few questions, nothing too complicated. And I want you to answer them from 1, which is not worried at all, to 5, which is very worried. Okay? And it's just about how you feel about different things. Ready? How do you feel about going to the dentist? 1 to 5. Okay. And how do you feel about having your teeth looked at? Mm-hmm. How do you feel in general about seeing a nurse? And what about seeing a doctor, like me? Okay. What about having your temperature taken? So that could be with a thermometer in your mouth. Yeah. What about blood pressure? So that's when we wrap that little band around your arm and we use our stethoscope. Yeah? Okay. Now what about having an injection in your arm? So not removing blood, injecting into you. Mm-hmm. And what about having an injection in your gum? Okay. How do you feel about being put to sleep during a treatment? So using an anesthetic, a general anesthetic. Okay. What about a mixture of gas and air? Now you might get that at the dentist. How do you feel about that? And how do you feel about having a local anesthetic? Yeah. So just to desensitize the area where we would be working. Okay. How do you feel about needles? Mm-hmm. Okay. I think that's pretty clear. First off, everyone is a little bit afraid of needles, okay? It wouldn't be particularly natural if we weren't afraid of having something popped into us. So there's no need to feel embarrassed, No need to feel ashamed or anything like that. I'm scared of needles, and I have to work with them almost every day. What we're going to do, we're going to do some breathing exercises and some general relaxation exercises to help you to relax before any kind of intrusion from a needle. Now, this is an exercise that you can practice anytime you go through a procedure or anytime you have bloods taken. Okay? So we're going to start off, we're just going to do some very simple in and out breathing. Okay? Nothing too taxing. It's really, really easy. So with me, I want you to breathe in through your nose or your mouth, it doesn't matter. So, and out. In and out. In and out. Now, just by controlling our breathing, not only do we take control of our body, but we regulate our body as well. So a lot of the time people get worried that if they're having their blood pressure taken, they can have anxiety prior to having it taken, so it might affect the result. That's why any good practitioner will take your blood pressure twice. So the first one is kind of control. And it's the same with blood. If you're amped up, if you're anxious or scared, it can affect the flow of blood to different parts of our body. So one of the things we need to do is take back control of our body and tell our blood where it actually needs to go. Okay? So now, I want you to concentrate on different parts of your body. Okay? Let's start really easy. Let's focus on your tootsies, your toes. You can close your eyes if it helps. You don't have to. So just think about your toes, where they are in your body, where they are in relation to everything else, and how they feel. I want you to tense your toes, lift them up, and then release them. Okay? Tense your toes again, lift them up, and release them. There we go. Now move up to your calves, so the bottom part of your leg. In the same way that you did with your toes, I want you to tense the calves, and I want you to release them. That's it. So tense your calves and release them. Moving up, we're going to the thigh. Tense your thigh and release it. Tense your thigh and release it. Now your glutes, your bottom, I want you to tense it and release it. Tense it and release it. Good. Moving up to your diaphragm, your tummy area. Tense it up, hold it in, and release it. Tense it up, hold it, and release it. Your chest, pecs, tense, and release. Tense, and release. Now we're going to shift across to your hands. Okay, so tense and release. Tense and release. Alternatively, clench your fist and release. Clench your fist and release. To your shoulders. Loosen up. Tense and release. Tense and release. Now I want you to go. Close your eyes, everything else, and release. and release. Okay? So what you can do, if you're ever feeling nervous, and I know it's a long process, but any good practice will allow you the time that you need in order to get comfortable before taking blood or anything like that. Okay? So, hopefully you're feeling a bit more relaxed. So what we're going to do now is we're going to talk a little bit about how we will take the blood. So first of all, we look for a very special vein on your wrist or on your arm. Alright? Once we find that area, we clean it. The area itself must be clear, so we'll look if there's any detritus or any skin irritation. We'll avoid that. And then once we find it, pop, we take the blood. Again, so we look for an area, special vein, we clean it. Once we've cleaned it, pop, and we're done. After that, I'll ask you to push a cotton bud onto your wrist. That's just to clean up any blood that might come out, and don't worry, it heals very quickly. It coagulates very quickly. And then we pop a plaster over it, or a band-aid, and that's it. Now, sounds easy, but it's still scary. So let me introduce you to someone. It's a syringe. Now this is just the demonstration model, okay? So, as you can see, that's how we get the blood out. We don't put it back in, okay? Now on the top is a cap. You can take all of this apart. So that's just the body of the syringe. You know what that looks like. Makes a funny noise. Here we have the needle itself. I'm going to take it out. Is that okay? There we go. Little. This cap stops anything from happening when we don't want it to go in, okay? How are you feeling? Remember that we're in complete control of this. You can just say, nope, Dr. Roberts, that's enough. Or we can just do it a different day, okay? Now, we're going to do what we call cap on practice. This is where we take the demonstration needle, we just practice with it, okay, with the cap on. So I want you to take a look at it again. It's pretty harmless, can't do anything to us right now. Hopefully you're feeling nice and relaxed. And remember, if you start to feel anxious or scared, breathe. In fact, let's do it. You are in complete control. Cap on. Find the spot. I've got like paper skin so you can see the veins pretty much. And then pop in the needle. Pull out the blood. Okay? Easy as that. find the vein, find the special vein that we'll be using. Okay. Pop in the needle. Take the blood. Easy. I'll only be taking a little amount because we don't need a lot. Okay. About that much. Now, I'm going to take the cap off and do the same thing because I want you to see that we are trained with this. So I can just show you. So find the area. In. Blood out. See? No mark. Again. Find the area. In. No mark. Easy. When we're done, pop the cap back on, and you know what? We always use a new one. So we will use a completely new one that no one has ever used before, so it's completely safe. Now, how do you feel? A little nervous. It's okay. Let's breathe. Okay, breathe in. Hold. Breathe out. Breathe in. Hold. Breathe out. Breathe in. Hold. And breathe out. So, what I'd like you to do got gloves on. Hello. My left hand, I'd like you to place your right arm, okay? That's it. So I'm going to look for the magical vein, okay? I want you to look at me. Keep looking at me. Everything's fine. And I'll tell you when we're done, okay? Alright, just keep looking at me. And we're ready to do. See? Now, take this cotton swab with your left arm. Just hold it on your wrist. Okay. Let's get you all plastered up. That's it. You did incredibly well. Okay? I'm really proud of you. It's a lot of the fear that we feel about a lot of things is the anticipation of it. The A to B, getting there, you know, waiting for something, that kind of thing. A lot of the time, once we get there, it's not as bad as we thought it was going to be. having said that, I am very proud of you. You did amazingly well. And you, if you so desire, deserve ice cream.